Welcome back to your Pelvic Health Podcast. I am your host, Susan Winograd, the owner of Pelvic Core Rehab, and I am thrilled to be here with you. I am so excited about today's episode, although I feel like I say that every single week, but I really am super excited every week about every single episode. We have Kelly Terry here with us today from Barwis Physical Therapy. And before I let Kelly introduce herself, I just want to tell you a story to sort of delineate how passionate Kelly is about what she does and how dedicated she is to her work, because it is rare that I am approached by an orthopedic physical therapist and I'm asked, hey, I'm an orthopedic physical therapist. I treat high-level athletes, and I really think we need to be working together. And that's exactly what Kelly did. And as soon as she walked into my office, I knew that we had to have this conversation. Welcome, Kelly. I'm so excited that you're here.
I'm excited too. Thank you so much for having me.
My pleasure. Thank you for coming. Kelly, can you tell our listeners a little bit about yourself, about your background, why you do what you do? Tell us a little bit, because it's so interesting.
Of course. I'll try to keep it short and sweet.
We got all the time in the world. Don't worry.
So I grew up in Canada. I was a hockey player at a fairly high level. I played at University of Minnesota and then went on to play for the national team. In that time, I was trying to figure out what I would do, post-hockey retirement, and always thought I wanted to do something in the medical field. As my hockey career was winding down, I figured I would merge those two passions and do physical therapy, because that is medicine, but I could also stay in that elite level athlete field. From there, I moved down to Florida. My parents have a place down here, and I figured what's a better place to do a doctorate degree than in the sun and away from those cold winters in Canada.
Florida's the best.
It is. Yep. I'm never leaving for sure.
Me either. And we have to kind of convince everybody that where they are living now is okay, and they shouldn't flood us with people moving in, because we also really like our space.
Yes,
it's getting really crowded down here.
Yes, the people who don't know I'm Canadian are always smack talking those snowbirds, and I'm like,
yes.
Well, I'm a permanent snowbird apparently.
Yeah, you're permanent now. You're a resident. I don't consider you having flooded in, and besides, you came before the real epic flood.
I did.
Yes.
So then at that point, I was finishing school, and I got one of my clinical rotations at Barwis Physical Therapy. Instantly fell in love with the place. I loved the atmosphere. I loved the patient population. Had some weird connections with some of the athletes that were already training there from my own athletic career, and actually one of the wrestlers from University of Minnesota. And it was the first day, and I'm like, wow, this place is my home.
That's amazing.
And I was fortunate enough to be offered a job. And so that was about 3.5 years ago. And I have been with Barwis Physical Therapy ever since. Don't play much hockey anymore, but I am living it up on the beach, playing some volleyball, surfing, golfing, all of that. So
that's amazing. I grew up north also, and I partially raised my kids up north, and hockey is a huge thing up north, and not really huge in Florida, right? I mean, it makes sense that it isn't, but I actually have one hockey player that I treat, but it's mostly soccer, volleyball, basketball. Am I wrong? I mean, I'm not that plugged into.
Yeah, you know what? I'm surprised at how much it's growing, actually. So you're right in the sense that, traditionally when I was growing up, there were very, very few players from Florida, if any, in the high level realm. And now it seems like because all the Northerners want to move to Florida, they get their kids into hockey early on, and it's starting to grow for sure. And now with the Panthers in the playoffs and doing really well, beating Boston, I think the sport's going to keep taking off down here.
I think so. If Northerners wanted Floridians to get into hockey, they could have just asked. They didn't have to all move down here.
It's true.
Yeah. So that's amazing. And I am so lucky that I feel like I live my mission and my purpose every day. I always say I have two missions and I have two purposes. One is my family and one is my work. And I feel so incredibly blessed that I have found my path to live my mission. And I knew that that you felt the same. I can see that passion and the determination and that like hunger to learn when we met. So I would love to hear why you called me.
Yeah, okay, so
I think that's like a great starter for the conversation, because I was, I almost did like a happy dance when Zara, my amazing client care coordinator, called me and she said, Susan, a physical therapist that treats athletes called you. She wants to meet with you to learn more about how you can help her athletes. And I looked at her, I'm like, I felt like the skies opened and sang. I'm like, finally.
All right. Well, I'm going to give a little shout out to one of our students. She is fantastic. We've already offered her a job 100 times, so maybe she'll take me up on it.
I'm gonna scale that back for a minute. I'm gonna double down and say it sounds like her passion is pelvic health, and pelvic core rehab is always hiring. So you have stiff competition here.
So her name is Amanda Anglo. She is a doctor of physical therapy who worked with us for 12 weeks. She did an in-service presentation on pelvic floor rehab. She is actually Herman and Wallace level 1 certified, if I said that correct, which I thought was awesome as a student going through and already kind of knowing which direction of physical therapy she wanted to work in.
That is amazing.
But she knew she was presenting to a bunch of sport and ortho PTs who don't know much about that realm. Right. So she tailored it to how it relates to sport ortho and our current patient load. So as she was going on through her presentation, she kept saying things that I was like, oh, that applies to that guy. And then, oh, that applies to that girl. And I just was thinking of all these people that I either currently working with or worked with in the past that I could have used some of those skills and furthered their care and made their outcomes even better than what I left them with. So with that, I just credit her for expanding my toolbox and the little things that I know and how pelvic floor health relates to what I treat currently.
And it's so related, and I give Amanda so much credit and so many props for really bringing it to the orthopedic world. There are quite a few pelvic health physical therapists that treat high-level athletes, like Anthony Lowe in Australia, Julie Wiebe, who has really revolutionized the world of pelvic health. She's the one that coined the term piston science, and they're really bringing the conversation to the table of why does pelvic health need to be on board in order for athletes to perform at peak performance? Yes. So I would love for you to speak to that a little bit. Maybe tell us a little bit about what you're seeing in the clinic. And, certainly I'll chime in, but what you see and what do you know now about pelvic health physical therapy that you now understand can elevate their level of performance by having pelvic health on board, by understanding that piston or deep core system?
Yeah, of course. So when you invited me on the podcast, I'm like, you know what? I need to know my stuff. So I did a little research as well on top of what Amanda went through in the presentation. And first of all, I realized the prevalence of pelvic floor dysfunction in athletes. And a lot of the research shows that's attributed to basically their high level of activity and the stress that they put their bodies through, whether it's through running or lifting or just sheer volume. As we know, that increased interabdominal pressure is going to put a lot of strain on the pelvic floor. And if you're not addressing that, you're going to get problems. Yeah. On top of that, the athletic population is very prideful. They're very competitive. And to talk about a topic that is a little voodoo and a little bit already uncomfortable to talk about is even more relevant with the athletic population. So with all of those things considered, first, the stress they put on their body and the stigma behind that conversation, you tend to have these athletes' diagnosis overlooked or mistreated, basically.
Right. And sometimes they don't share.
Right.
They don't share. And that's why I think every orthopedic physical therapist, whether they're treating high-level athletes or senior citizens or young adults, should be asking about bowel and bladder function. In fact, Nicole Kozin, who, really also kind of streamlined and standardized a questionnaire so that, or it's a simple 5-question questionnaire that orthopedic physical therapists or anyone for that matter can give their clients and ask them basic questions about pelvic floor function. And if they answer yes, then you know that they may need a referral to a pelvic health therapist. And I think that was really important in the field because it takes a little bit of pressure off of the orthopedic therapist to have that conversation if they're not super comfortable. Right. I personally think that we all need to get comfortable having that conversation, but it also opens the door for a client to be a little more comfortable talking about it. I had a client last week who came to me postpartum and, she was a midwife and she came to me for just general postpartum healing. And I asked her about her bladder function like I do with everybody. And then I asked her about her bowel function and she kind of looked at me and, she was like a little embarrassed. And she said, "Are you asking me that because of what I put on the questionnaire?" And I said, "On your intake form." And I said, "Yes, I review those quite carefully. And I did notice that there may be, something that we need to address that may be contributing to your overall picture." And because it was already in the intake form, because I had handed her a questionnaire, she felt more comfortable starting the conversation. So I think it's kind of like a two-way street. We need to get comfortable talking about it, and we can make clients more comfortable opening the conversation about it, doing that. I'm always looking at statistics with or incidents with athletes and pelvic floor dysfunction, and I actually thought it would be interesting to bring some of that to the conversation today. So you did your homework and I did my homework. Awesome. And I am going to just throw a couple of percentages out there. And I always say this when I talk about, incidents of issues or dysfunction, not to scare people, not to pathologize, not to catastrophize, but sort of, again, open the conversation that this is really happening at a frequent level in our entire population. And it is common, but it's not normal. And it's something that we could definitely address. And what I saw was that 26% of all female athletes have some form of incontinence. That's way too high. That's common, but not normal. I remember when I was never a serious CrossFitter, but for about a year, I went to a CrossFit gym and people would kind of joke around about how they leaked.
Yes,
and
all the time.
I'm a pelvic health therapist and I'm like, that's not funny.
Yeah.
And right. And I feel like it's I'm not in the, high-level athletic world, but I hope that conversation of making fun and creating this joking banter about that is not becoming a culture, because we certainly don't want to normalize that.
I mean, unless it's going to make people more comfortable to talk about it. But
unless they're going to do something about it and not high-five each other because they had a good workout.
Too. Yeah, I know. But I was thinking, though, when patients bring up pelvic floor issues, it's usually, to me, usually in a joking manner. Like somebody was like, that's going to make me pee my pants. And then I'm like, let's talk about that.
Yes.
And to your point, it's not something that my clinic will typically screen for. And it's something that I would like to start to be more aware of. And that's why I would love for you to come talk to my staff and educate us all a little bit more. But people just think it's normal. Yeah. So for us to not even be aware of this until a couple appointments in and they're joking that they're going to pee their pants, it's like, wait, why didn't I know this earlier? I definitely should have asked, or they should have told me, or something like that.
Right. And to speak to that point a little bit more, a lot of times that is the root cause. That is the generator of their symptoms. So if we're not talking about it and they're not telling us and we're treating what we think is the underlying cause, we may get temporary results, but we're not going to get long-lasting healing if we don't treat the root cause. Just another couple of really interesting ones. 33% of high-level athletes have some form of pelvic floor dysfunction. The incidence was much higher in women than it was in men. How common is it to have pelvic floor dysfunction in weightlifters? There was a study that looked at 180 women and 204 male high-level athletes, and out of all the women they tested, 50% reported having urinary incontinence, 80% recorded fecal incontinence, and 23% of the women reported having pelvic organ prolapse. That's really, really way too high. I mean, any percentage is way too high, but I thought those numbers were astounding.
Yes, that is astounding for sure. I saw in research again, because I was preparing for this, they were looking at postpartum women who are of a high-level athletic population versus not, more sedentary females, and they suspected that the athletic population was going to have a stronger, less dysfunctional pelvic floor because they're stronger. They're better at these types of things because they know how to brace themselves and all of that. However, it was the complete opposite, and they attributed that again to the strain that you put on your body through athleticism, which isn't a problem. Don't be afraid to exercise.
Right.
But do it in the right way and making sure that you're also addressing the health of the pelvic floor at the same time. And that was astounding to me as well.
Yeah, it's such a misconception. I think it's getting better, but so many people out there think pelvic health is all about Kegels. And I really would venture to say that I probably work more commonly on releasing the pelvic floor than strengthening. Maybe at least equal amounts. But, you know, we all hold tension in certain areas. We very commonly hold tension in the pelvic floor. Certainly, if we're a high-level athlete and we need to recruit that system, first of all, we really need to make sure that we're working with the core components. We need to make sure that we're generating the support from the inside out. But certainly, if we're asking those muscles to work at that level of sport or, you know, athleticism, then certainly we need to work on releasing them and relaxing them.
Yep.
We do that with our hamstrings, right? We do that with our glutes. We do that with our quads. We also need to do that with our pelvic floor muscles.
Yes. Yeah. Tone doesn't equate to strength, as we know. So that applies to the pelvic floor as well.
Yeah. And what I always say is that the pelvic floor muscles need to be at a healthy length tension relationship. A tight muscle is not a strong muscle, right? That muscle, the pelvic floor muscles are skeletal muscle like any other muscle in the body. They need to be able to contract over the full length of their muscle, and they also need to be able to fully relax. Yes. And I think that is what people really don't understand, and I don't blame them. It's because it's a group of muscles that you really can't see externally. It's so much easier to visualize the biceps or to visualize your quads. Right. You really need to know your anatomy in order to really understand how that system works, and that's why you are at Barwis, because you're going to teach everybody, right?
I hope so, yes.
Yeah. Kelly, how have you sort of integrated and applied what you learned from Amanda? And I know we had an amazing meeting when you came to Pelvic Core Rehab, and it would be my greatest pleasure to come to Barwis. And I love working with other therapists. I love working with Pilates instructors, yoga instructors, personal trainers, because I think it's like a huge aha moment for them that there's so much more to learn about the body, and that we really don't spend enough time learning about the deep core system and how it works and the impact it has on the rest of the body. So can you share with us like tips and how you've integrated this into your current practice, and have you seen a difference in results? What are your clients saying about it?
Yeah, of course. Well, I would say, first of all, there's a ton of different conditions where we will address the deep core system. If a patient has back pain, that's a pretty typical one. You need a strong core for you to function properly without increase in pain.
Right. Low back pain is actually the number one symptom of pelvic floor dysfunction.
Makes total sense for sure. So before PT school even, it's like, oh, your back hurts, you need a stronger core.
Yeah.
And it's true. There's a lot to it, but that is true. And I think as orthopedic physical therapists, we treat what we see and what we can palpate and tend to ignore those touchy areas where pelvic floor specialists excel at. So I could have a patient lay there and do transverse abdominis activation all day long. I feel like I'm really skilled at cueing them correctly and advancing those exercises. But then you get them standing and into a functional position and they might plateau. And it's like, what is going on? How come I can't get that same engagement in a supine to standing position? And I think that's sort of where my brain started to go when I started to look you up and talk to Amanda and figure out that, what I am typically looking at might not be the full picture. And so at that point, it's important to go ahead and look at pelvic floor and what might be going on there, because as we know, the deep core system is anticipatory. So once that athlete is about, or that client or patient is about to do a movement, we need everything to engage at the same time in a coordinated manner. And we might get, transverse abdominis, your diaphragm, your breathing techniques all down correctly. But if that pelvic floor is not coming with it, you're not going to get stability, especially in those higher level positions like in standing.
Yeah, that I'm so glad you brought that up, and it's brilliant. The deep core system is the only system in our body that's anticipatory and reflexive. Mm-hmm. It anticipates the movement of our body. I think it's 300 milliseconds, don't quote me on that, but I believe before we laugh, before we cough, before we sneeze, before we jump, before we lift our arm, before we strike our heel to walk, our deep core system is what keeps us upright. Right? If you think about it, if we didn't have anything pre-engaging before we moved, we would not have that stability to stay upright. So it needs to be reflexive and anticipatory, and it is a sensitive system. So I see all the time where people either lose that reflexivity, they lose the anticipatory response, or they lose the speed of anticipation.
Right.
And as you know, there are two different muscle fibers in skeletal muscle. There's type 1 fibers, which are more endurance, long-lasting fibers. And then there are type 2 fibers, which are quicker responding, but also quicker fatiguing. Mm-hmm. And we really have to make sure that both are functioning optimally. So what happens, Kelly, if your client has lost that anticipatory response? I mean, how are they performing now?
Yeah, so I think we talked about this example when I was in the clinic with you at Pelvic Core, and it's definitely relevant because I am a hockey player, and we're NHL season's winding down. We get a lot of our pros coming in. So to answer your question on what happens, well, injury can happen. Yeah. If we look at these pro hockey players or high-level skaters who are constantly on the ice, you see chronic groin and hip flexor strains. So if we're dialing in on that example alone, these athletes may have strong hip flexors, for example. And in isolation, they may be presenting like, this is rock solid. Why is it always getting injured? And at Barwis Physical Therapy, we use handheld dynamometers to measure strength objectively, which I love. It makes our job really easy to track changes over time and all of that. But that isolated strength is not the whole story. We also want to see that those muscles proximally are stabilizing correctly. So that includes the pelvic floor.
Yeah, and it's so interesting that you brought that up, because grip strength actually is a huge predictor for overall health and longevity. It's strong grip strength is an indicator for cardiac health. It's an indicator for cognitive health.
I didn't know that. That's
Yes,
cool.
There's actually a ton of research in it, and I'm going to give one of my greatest mentors, Carolyn Van Dyken, credit for bringing this to my awareness. But grip strength is a huge indicator in overall health. They found that people with better grip strength, had better quality of life. They had less dementia. They had better cognitive health. They had better cardiac health. I'm not really sure I wonder. I'm not really sure what the connection is. I wonder if people with better grip strength are just have better all level of fitness, lifestyle. Maybe they have an active lifestyle. But, certainly there are things in isolation that could promote decreased grip strength. But I think it's such a good, easy test to sort of check right and left.
And actually, we use the handheld with motions like hip flexion. So we're having them push into those directions instead of doing a typical manual muscle test where we're subjectively like, that's a 4,
I love
that's
that.
a 5. And it's especially important for our population because they're probably a 5 on both sides. It's just one is 50% weaker than the other, and we need to know that. So we're using the handheld, through the whole body, not just through grip strength. But yeah, so we'll see that these numbers are strong and they look great, but we're not getting that proximal stability. And this is what I was talking to you about. I'll educate patients on the difference between those moving muscles and the stability muscles. So if you have a muscle like a hip flexor that's trying to do its job while you're skating, pulling your leg through, and it's really strong and it's doing the best it can, but the proximal muscles are not stabilizing appropriately, you can imagine how hard that hip flexor is going to have to work for you to get an effective stride on the ice. If you are not getting that effective stride or that effective contraction because of the lack of stability, you're going to be prone to injury and overuse problems with those muscle groups.
Absolutely. And just for our listeners who don't know what proximal means, it means higher up, closer to the core. Distal means further down the chain.
Yes, sorry about
that. So no,
that.
that's okay. So proximal muscles would be those closer to the pelvis, closer to the shoulder girdle. When I give workshops, I always say, when you think of the core, what do you think? And, almost always people think about the six-pack muscles or the obliques. And what people don't understand is that those muscles are the movers.
Yes.
They're part of the deep core system. But if we're always using the movers to stabilize us, our deep core system is going to shut off. Our bodies are so efficient. They're not going to work any harder. It's not going to work any harder than it has to.
Yes.
So if our, rectus abdominis is on overdrive, our hip flexors, our psoas, our QL is on overdrive, our pelvic floor muscles are going to be like, oh, you know what? I can kind of go on vacation.
Right.
So we need to, kind of calm those muscles down and wake up the deep core system in order to create balance.
Yes. Yeah. So
Right.
we'll often start with anti-moving exercises first, and that will help engage those muscle groups. And now, being a little enlightened to the pelvic floor world, cueing them to also engage in that way and control their breath and things like that.
Right. That's so important. I think there's not enough focus on managing intra-abdominal pressure in the athletic community. I treat athletes, not high-level athletes, and so many times I see breath holding or I see, poor management of intra-abdominal pressure.
Yes.
And I think we just need to interject to make listeners understand why that's so important. And that's because the deep core system is led by the breath, right? We inhale, there is an increase in intra-abdominal pressure, everything lengthens, broadens, and there's a broadening, a lengthening, and a stretching. We exhale, and there's a decrease in intra-abdominal pressure, and everything shortens, recoils, and engages. Mm-hmm. So when we breath hold, we're essentially inhaling, we're holding on to that pressure, and then we're doing something that, requires a lot of exertion. Mm-hmm. And that can lead to, an abdominal separation. It can lead to pelvic organ prolapse. And, one thing that I always teach my clients is the concept of tension to task. I think we talked about this also. So many clients I see, I think it like in the 80s, I you're like super young, Kelly, but like we were taught, and I don't mean to like blame Jane Fonda for this. It's not your fault, but I kind of equate it to her time where we were like kind of trained to like suck it in, right? Like keep those abdominals engaged all day long. And that's not how we're meant to function as humans. We're meant to exchange pressure, not suck and grip all day. So what I teach people at Pelvic Core are attention to task principles, which means we need to generate as much support from the deep core system as the task we're asking it to do. So for example, getting up from a chair will not require the same strategy as doing a push-up or a sit-up or a deadlift,
right,
or, you know, any kind of weightlifting. So is that something that you deal with a lot in your, you know, demographic? Do you feel like they're more aware of the breath?
I do, but after cueing. So talking about, you know, when we're starting with those anti-movement exercises that are very simple, from the surface, they're very simple.
Right. People are always like, oh my God, this is so much harder than it looks,
yes.
right?
Yeah.
Like even when I do Kegels or relaxing their pelvic floor, they're like, oh my God, I think I'm going to be sore tomorrow.
Yes. And it's confusing. Like you're so hyper-focused. So my first thing is, you know, try not to hold your breath. I would like you to be able to engage transverse abdominis without holding your breath. Your diaphragm is able to stabilize that deep core system while still breathing, because when you get up from a chair, you don't hold your breath.
Right. Hopefully. Although I have seen that many times.
Right. But it's not practical, right? So you have to be able to control those things while you're doing functional movements. And as a result, we need to train that way as well through exercise and physical therapy. Yeah,
I totally agree. I actually love training that with balloons. Just training like transverse abdominis engagement with balloons. Trista Zinn, who I thank always and consider a mentor for teaching me hypopressives, uses, you know, she's taught us that we can use breath trainers with clients. So breath is so important. I mean, I'm everybody that knows me knows I'm obsessed with breath, and I pretty much think you can change every system in the body using the breath. And people always ask me, is it okay to ever hold your breath? And pretty much there are a couple of times it's okay, but one of the times with weightlifting that it's okay is when you're doing a 1 rep max, right?
Yep.
But even
that Valsalva is going to get you that extra strength and stability through the core and increase performance more than anything.
Right. But correct. But even when we do that, we do it a certain way, right? We do that breath hold after we exhale a little bit, because we want to do that breath hold on top of an exhalation when the system's already engaged, when the system is contracted. So I think that for anybody that performs on a high level, they should see an orthopedic therapist who is very knowledgeable in pelvic health or really knows their deep core stuff, because it could really, really make a difference in long-term health.
Yes,
right?
Of course. I agree.
Yeah. Do you see as many of your male athletes with pelvic health issues versus women?
Yes. So I would say, first of all, our high-level athletes are more often male. And so we're dealing with people with sports hernias, low back pain, as you said, relates often to pelvic floor dysfunction. The only reason why I feel like it evens out a little bit is because the female population is way more comfortable talking to me about it.
Interesting.
Yes. So that's why being more transparent with things would probably make it more evident that there's also males that are having these issues as well. But at this point, I would say it's fairly even for those reasons alone.
Yeah, and I would even venture to say that the men who are having issues want to talk about it. I think they just don't want to initiate the conversation about it.
Yes.
Because I think anybody that's leaking or has pelvic floor dysfunction or has pain before, during, or after an orgasm, they don't want to live with that. And I think if we could normalize having those conversations and say, you can still continue to do whatever that it is that you're doing. Let's just give you a different strategy.
Right.
Let's just give you a modification. And so many times I treat clients for a multitude of reasons, and then they come back to me and they're like, this is crazy, but I was able to run longer. I felt lighter. I was able to lift heavier. I feel so much more energetic. And it's because you're using your body the way it was meant to be used. You are so much more efficient. You really are so much lighter.
And I think that those responses that your patients have really solidify the connection that I have as a sports ortho PT and you do as a pelvic floor specialist, because addressing the pelvic floor directly relates to improved performance.
Yes.
So,
yes.
Yeah.
Yes. And I think that when we talk about stressors also as a pelvic floor physical therapist and even as an orthopedic physical therapist, we also have to look at what kinds of stressors is the person going through, because there are chemical stressors. I mean, we live in a very toxic environment. There are emotional stressors and there are physical stressors. And I think very often it's overlooked that the emotional stressors can have physical manifestations. So, I think it's super important to sort of dive into that a little bit, because again, all the signals are generated through the nervous system. And if your nervous system is in protective mode and it feels like it needs to protect that body, or it's in fight or flight or freeze, you can release any muscle all day long. But if it is in that, emotional stress phase and they have like anxiety, depression, catastrophization, worry, they're always going to go back into protective mode. So I just wanted to add another dimension to like, what is stressors? What kind of stressors do we have in life? And I'm sure high level athletes have a lot of emotional stress because there's a lot of pressure.
Yes, of course. And I think that is even accentuated when somebody's performing poorly in their sport. And so it's like kind of what came first, the stressor or the poor performance, and both can be related to pelvic floor health and performance and muscle performance.
Absolutely. I think the most common term I use in my practice is it's always, is it the chicken or the egg?
Yeah.
People want to know, but why? And we don't know how the cycle started.
Right.
But the good news is that you can stop the cycle. You can retrain your brain. You can retrain your body. And I think that should be the big message, right? I had a client who I just had a phone conversation with her yesterday. She was seeing another wonderful therapist in my practice. And she said, we focused a lot on breathing. Is it really that important? And I said, whatever she said, how important it is, it's more important than that.
Yeah.
Your breath is what leads the pelvic floor. And when we look at breath, we really dive into, where is the breath going? Where is it not going? Where do we need to send the breath to get more expansion to? How is the breath coordinating with the transverse abdominis, the pelvic floor, and the deep extensors in the back? So breathing is important, people. We got to do it to live, right? It's the number one priority of the brain. The brain's goal is to keep us breathing, to keep us alive.
Right.
Kelly, I know that you're going to do amazing things. And I know that we're going to continue to learn from each other. One of my favorite athleticisms to treat is sports to treat is running, because you could really see in runners when there's proximal instability. It's so obvious, right? If you just ask them, running is a one-legged activity. So if you ask them to go into a little bit of a squat and their knee looks a little bit like it's going inward. So there's so much we could do in every sport to help people. I would love for you to talk about some takeaways for our listeners. I know we could talk about athletes, and I know we're both PTs. We could talk about PT all day.
Yeah.
But what are just some key points that you would like our listeners to walk away with?
I think if you are a fellow physical therapist listener, or if you are an athlete looking to solve your own problems or have ideas on where to go to solve your problems, I think it's important to think outside the box. And in my world, pelvic floor therapy is outside the box, because it's not something that is on the forefront of a lot of our orthopedic minds. And
that's okay.
Yeah.
we need to know what our lane is.
Yeah, of course. And so my biggest takeaway is if something is not adding up and the traditional ways of treating a certain condition is not enough, maybe it's time to dive into the realm of physical or pelvic floor physical therapy, and maybe it's time to work with one of your specialists in the area who can give you a little more information on how to treat these types of things.
Yeah, and I'm so thankful that you reached out to me. I love working with other practitioners because ultimately we want to help our clients achieve their goal. We want to help our clients achieve their destination. And if we work together, we all have our own lane and we all have our wheelhouses, but if we can recognize how we can help each other and use each other in the right way to help our clients reach their goals, to me, there's like no more beautiful thing.
Right.
And
I agree.
Clients love you when you're like, you know what? I have the humility, and I do this all the time. I have the humility to say that there's something going on that I'm not seeing.
Right.
Let's get a fresh pair of eyes on you.
Of course.
And I just know that we will continue to have a beautiful and wonderful collaborative friendship and working relationship, and I will learn from you. And I know Pelvic Core is that's all I feel like we give workshops more than we treat. I feel like so because we love teaching. But I know people are going to want to find you, and they're going to want to find Barwis. So can you tell us where our clients, our listeners can find you and learn more?
Yes. So our Instagram page is Barwis Physical Therapy. It's BARWIS. And our website, same thing, barwisphysicaltherapy.com. You'll find all of our information there. It gets a little confusing because we are a giant sports performance facility as well. My realm is just the physical therapy side. And send a message through there. We'll answer any questions that somebody might have. We are located in Deerfield Beach primarily. Or I shouldn't say primarily, that's where I am located.
So that's the only important place. I'm just kidding.
No, our therapists in the other locations are amazing too. So we're also in Fort Pierce and Jupiter, and then we're actually in Colorado. So
wow.
Yep. A little outside of South Florida area, but all follow the same methods. Mike Barwis is our guy. He is a master in all things performance and rehab, and we follow those methods and really get great results for our athletes and patients.
That's amazing. I really can't wait to learn more from you. And I know our clients are going to want to learn more from you as well. And we're going to have all of your links in the show notes. So people that didn't catch that when you said it, they'll be able to look at it in the show notes. And
Perfect.
I can't wait to keep doing great work together. I really, really can't.
Oh no, I'm excited too.
Me too. Thank you so much for tuning into this episode of Your Pelvic Health Podcast, where we give you the real lowdown in all pelvic health matters. Don't forget to like, follow, and please give us a 5-star review so we can continue to bring you all of the information and all of the topics that you want to hear about. And if you found this episode helpful, please share and tag us. And don't forget, you need to be your own best advocate, and that pelvic healing requires a whole body approach.